Hello, Dr. Berg here. In this video, we're going to talk about if your knees are bone on bone and you have no more cartilage left, and let's say you're not excited about getting surgery, you want to postpone it as long as possible, we're going to talk about some possible solutions. Now, it's kind of a catch-22 because here you are, you might be overweight and you need to go exercise, but you can't because your knees are killing you, so you can't lose weight. So here you're stuck between a rock and a hard place. So what are you going to do? There's about 3 things you should do. Number 1, you want to get your knees symmetrical. So many people have an out of balance situation between their left leg and their right leg. And I'm talking about a slightly longer leg, which then puts pressure on the knees, okay? It throws everything off. If you can get your knees totally symmetrical when you walk and there's no imbalance, you can reduce the tension and stress on the knee joints considerably. And some people don't even need to get surgery. I'm going to put a link down for a separate complete video on that, but I'll tell you in a thumbnail sketch just a brief thing on it. The mistake that most people make is that they look at the bottom of your leg lengths, okay, and like there's one short leg, like let's say you have a short leg, and they give you a heel lift to make this balanced, right? It's a big mistake because usually the reason why that leg is short is because the hip is higher on the short leg, okay? So the leg isn't short at all, it's just a high hip. Your hip is higher at one side and your spine is crooked. So if we put a heel lift in the short leg, we drive the high hip higher, worsening the symmetry of the left and right side of your lower part of your body. So you want to go by your hips. You can get an x-ray or just have someone eyeball it, with your belt or where your pants goes across. You want to go by the hip. And so let's say, for example, you look at the hip and the left side of your hip is dropped down. You would want to put the heel lift in the longer leg. Okay, like a little lift in your shoe. I've done that with people and it's just take all their knee pain, it just completely goes away just by balancing the leg, okay? It's really a pelvis problem. They fell on the butt bone on one side a long time ago, and ever since then it's been out of whack. So that's step 1. I put a link down below on a complete video on how to correct that. Okay, number 2, there's some really great acupressure things that you can do for knee pain in general. I'm going to put another complete video down below, but if you have pain on one joint only, okay, and not on the other one, you would want to work on the opposite side on the muscles higher up. I put a video down below, a link, so you can see what I'm talking about, but this is if you just have one knee that's hurting, okay? But you might have both of your knees hurting, so you wouldn't need to watch that. But the point is, if it's just one side, you need to watch this video. That will help you considerably, because if we could just take and balance your knees doing acupressure, that will take the pain right down, okay? 3rd thing, reducing inflammation. Because if you have bone and bone, you probably have a lot of inflammation in your knees, and we need to get rid of that before you start exercising or walking or anything like that. Now, typically what happens, people that have bone and bone have a lot of extra weight that they need to lose, okay? I'm assuming you do. You might not, but if you do, you're in luck, because the best thing to do would be to do a program that fixes something called insulin resistance, okay? So insulin resistance is the #1 cause of higher levels of insulin that causes belly fat, a stuck metabolism. So if you were to fix this, going eating plan to fix this, that would bring your inflammation way down. It's dramatic, it's powerful, and if you have bone and bone, you need to do this. You might be in a situation where you could reduce all the inflammation and pain, and even though you have bone and bone, you're walking around and you're fine. You have no more pain. That happens all the time, especially with inflammation, okay, and swelling. And then you'll lose weight too. 85% of a person's weight can be handled with eating. 15% is exercise, okay? So we don't have to do the exercise right now anyway. So what you want to do is in a summary form, and then I'll put some links down below. You want to start with 3 meals, no snacks, okay? Why? That's intermittent fasting. So to go from one meal to the next, you have to add a little bit of healthy fat so you're not as hungry. The snacking in between the meals and the snacking at night is going to really destroy everything. The small 5 meals a day or 6 meals a day has to go. You want 3 meals, that's it. Okay? You want to have a lot of greens and vegetables because that has the vitamin C to help build up hormones that are anti-inflammatory. All of the hormones that are anti-inflammatory, they're the adrenal gland hormones, need vitamin C as a precursor. So you need to consume a lot of vegetables and some protein, small amount, and actually higher amounts of healthy fat at the meal. So you start with 3 and you do that for a period of time. And then when you get used to that, you want to go 2 meals a day. Don't eat in the morning, go all the way until lunch, and then have your dinner. So you have 2 meals a day, and now you have from dinner all the way to the next lunch of not eating to heal the insulin problem, because insulin is triggered when you eat. So if we could take all the stress out of insulin, inflammation comes way down and you no longer hurt in your knees and you can postpone the surgery. Okay, so add a lot of vegetables. There's one other thing that you may want to check out too. I have a joint support formula that has in it not just the standard things like glucosamine and things like that, but it has in there adrenal extracts so to support the adrenal. It has in there some serious natural food complexes of vitamin C. It has in there some herbs that are anti-inflammatory, like stinging nettle root, which are very powerful. So I put a link down below. You can check it out and get more information. But those are the things that you need to do if you have bone on bone and you want to postpone surgery as long as possible. Thanks for watching. Hi guys. Hey, listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now and we'll send you a report.